Hello, friends. Today, let's talk about the big news coming out of STTK. Of course, seeing huge movement pre-market, up slightly green as of yesterday, but this morning we got some big news that is causing it to basically double up, which is impressive, of course. So right now, sitting at $4.44, up $2.33 so far in pre-market on pretty impressive volume as well. So what is causing all of this interesting movement? Well, let's take a quick peek at it. So, Shattuck Labs is a biotech company, and it just shared some exciting news about their experimental drug, SL-172154. They've been conducting a phase 1 clinical trial in patients with high-risk myelodysplastic syndrome. Myelodysplastic syndrome. All right, HR-MDS and TP53 mutant acute myeloid leukemia, or AML. So we are talking cancer, folks. The initial results are looking pretty promising in the frontline HR-MDS patients, especially those with TP53 mutations. They saw an impressive objective response rate of 79%. About 64% of those patients received complete response or Marrow Complete Response. In frontline TP53M AML patients, they observed a 27% rate of complete response or complete response with incomplete hematologic recovery. They also found that 5 out of 11 of the evaluable patients experienced stable disease and decreasing blast counts and improvement in peripheral blood counts. So, moving in the right direction on that as far as basically tackling this leukemia. Not only that, but the combination of SL-172154, again, that is the experimental drug that they're working with something called Azacitidine, AZA, was well tolerated and didn't have any major safety concerns, according to them. So, this is great news for potential use of SL-172154, their drug, as a new treatment option. So, clearly, Shattuck Labs is very excited about these positive findings. They're planning to expand the study and increase the sample size to gather more data, and they also expect to provide further updates by mid-year 2024. It's important to note that these are really early stage results, but they suggest that SL-172154 could be a promising therapy for frontline HR-MDS and TP53 AML patients. Shattuck Labs will continue to closely monitor and evaluate these patients to gather more information about the drug's effectiveness and safety. So overall, this is a pretty exciting development in the field of cancer treatment, and it's a great opportunity to see an innovative company like Shattuck Labs making progress in the improvement of lives of patients with these challenging diseases as well. So let's take a quick peek again at pre-market. Now sitting at $4.15, so dropped a little bit, but I'm really excited to see what happens at open. Obviously, big news early on in the game as well, but certainly something to keep our eyes on. Now let's take a quicker look here at the diseases that this drug is supposedly trying to tackle first. HR-MDS, typically referred to as high-risk myelodysplastic syndrome. Myelodysplastic syndrome are a group of disorders that are characterized by abnormal development and functioning of the blood-forming cells in the bone marrow, in this context of HR-MDS. So high risk is the designation that indicates the MDS is considered more aggressive or has a higher likelihood of progressing to acute myeloid leukemia, which is a more severe form of blood cancer. Myelodysplastic syndrome in general involves dysfunctional blood forming cells in the bone marrow, leading to insufficient production of healthy blood cells, and this abnormal cell may not mature properly, resulting in a variety of symptoms related to low blood cell counts. The classification of MDS into high-risk or low-risk categories is based on various factors, including the percentage of blasts, which are immature cells in the bone marrow, the types of blood cells affected, the severity of cytopenias, deficiency of blood cells. So, high-risk MDS is often associated with a higher percentage of blasts in the bone marrow, more severe cytopenias, and other unfavorable features. It carries a greater risk of disease progression and poorer outcomes compared to low-risk MDS. So, obviously, we are hoping a drug like this can really make an impact on the HR-MDS. Why? Because, well, it is from its designation, obviously, it is a leading indicator for more difficult leukemia in the future. So you do have already a few options that include aggressive things such as chemotherapy, stem cell transplantation, basically just supportive care, and of course we've got some clinical trials, which is what we're looking at here at STTK. But if you do have HR-MDS, certainly looks like quite a bit of pain, quite a bit of suffering, unfortunately, and hopefully we can find treatments that are successful, and that's why this information coming out today is so interesting, at least to me. So now let's also take a look at our other concern that we're looking at here. Let's see here. Where did I put my notes on that? So we're looking at TP53M-AML. So the TP53 mutated acute myeloid leukemia refers to a specific subtype of acute myeloid leukemia that is characterized by mutations in the TP53 gene. The TP53 gene is a tumor suppressor gene that plays a crucial role in regulating cell division and preventing the formation of cancerous cells. Mutations in this gene can lead to development of various cancers, including AML. In this context, AML TP53 mutations are associated with a particularly aggressive form of the disease. AML itself is a type of blood cancer that affects the bone marrow and blood, leading to rapid production of abnormal white blood cells. When the TP53 is mutated in AML, it can result in resistance to standard treatment and poor prognosis. So, obviously, a devastating prognosis with this TP53 gene. Basically, your body is working against you and essentially creating abnormal cells, leading to cancer, leading to a real sort of struggle when it comes to treatments as well. So, really, again, crossing fingers that not just from, a stock price movement standpoint, but from a humanity standpoint, that this drug that STTK is working on, hopefully, right, crossing our fingers, hopefully for the good of mankind, it is as positive as it appears to be, at least in the early stages. Again, lots of research to be done, lots of more clinical trials to be done on this. We are in the early stages of this drug, and but again, crossing fingers. But for now, we are certainly seeing impressive stock movement. Right now, we're looking at 7:56 a.m. Eastern Standard Time. Before market, we are sitting at $4.22, up 100% on the day. So invest carefully, invest wisely. Again, cross your fingers with me that this drug treatment actually is as productive as it seems to be. Take care, everybody.